My name's Jeannie Burnie, and I am a clinical nurse specialist at a large metropolitan health system in Cincinnati, Ohio. I started looking at blood culture contamination rates about 10 years ago. At that time, I was the educator in our emergency department. We were concerned about length of stay. We were concerned about patients getting antibiotics that they didn't need. And I came across Kurin at a nursing conference that I was attending. And so I began investigating, and I started working with our microbiologist in our organization. And she thought that it would be a good idea to investigate using this product. So, like a good clinical nurse specialist, I went to the literature to look and see what should we be doing, right? We'd done some of that whenever we were doing the education, but whenever we looked at some clinical practice guidelines, we found that using a diversion device was something that could make us more successful. And so that's how we started going down the path of looking at using the diversion device, and we chose Kurin. Another reason that I like the Kurin device is because of the volume of diversion is much less than other options. And for me, that has worked well. And it also helps our patients to not have problems with iatrogenic blood loss. Kurin is an ideal partner in my perspective because of the support that you get from the company. I really say that Kurin is the standard setter. I even use the company as an example to other vendors who come to me. I want to know that if I call on them, they're going to be respectful and return my calls and give me what I need to make sure that the product's working effectively, and Kurin does that. Our Kurin Clinical Outcomes Director really has become an extension of my education team. My staff nurses know her across all 6 of our emergency departments. That's the beauty of having this kind of a relationship with a company is I call, or my educators call, and she comes and helps us to identify any kind of issues that we're having with the product. The clinical outcome that we were the most impressed with was the reduction in blood culture contaminations whenever we started to use the Kurin device. Our initial trial, we cut our blood culture contamination rates in half. We were actually so excited about it that we were able to publish a manuscript in a peer-reviewed journal. I'm confident by using the Kurin device and decreasing our blood culture contamination rates that we have helped to decrease length of stay for our patients, and that we've also helped to decrease our patients getting antibiotics that they don't need. When I think about the financial impact, of course, I think about the length of stay. If you work in an emergency department, you know that patients are holding. Today, we have holds in our emergency department. So by impacting that length of stay, that has to help us in the long run to help get patients out of the hospital more timely so that we can improve that throughput and get patients out of the emergency department. So the financial impact that we found using Kurin during our initial trial to see if we were going to be able to utilize the device across our system was about a $2 million impact. And that was significant enough for us to be able to take the results from one emergency department and begin to spread them to other emergency departments. Kurin really ties it all together by helping us with an innovative device, making sure that we're using best practice, and their education support is amazing.